Hey, what's up and welcome back. This is part 3 of the To Detox or Not to Detox series. If you've watched part 1 and 2 of our detox series, you know that toxins can significantly impact fertility in so many ways. But today we're diving into the toxin burdens that almost no one is talking about. I had a patient, Alice, who's a veteran, who struggled with unexplained infertility for years. When we tested her for heavy metals, her levels were off the charts from military exposure. Within 6 months of targeted detox, she conceived naturally. Today, I'm sharing the hidden toxins that might be affecting your fertility. Whether you're a veteran, a farmer, a construction worker, or none of the above, welcome back. I am Dr. Aumatma Simmons. I'm a functional fertility specialist, and I have been practicing in this space, supporting couples with their fertility for almost 15 years. I've also been a naturopathic doctor for close to 20 years. And today we're talking about detoxification specifically. This is part 3. If you haven't watched part 1 and 2, I recommend you pause this video, go watch those first, and come back to this because this series is like a mini masterclass and you're going to want to know in sequence exactly what we talked about first before you get to this. So let's get into it. Today, we're focusing on toxin burdens that are, again, rarely often talked about. We often talk about endocrine disruptors like BPA and phthalates, and there are significant toxin categories that have profound impact on reproductive health, like heavy metals, occupational exposures, and military-related toxins. Let's explore these hidden fertility disruptors and what you can do about them. Heavy metals are amongst the most common concerning toxins for reproductive health, yet they're rarely tested for in conventional fertility workups. The primary heavy metals that impact fertility include lead, which has been researched in environmental health and has shown that lead exposure is associated with reduced fertility in both men and women. For men, it leads to reduced sperm count, motility, and considerably lower morphology. For women, it is associated with irregular cycles, reduced ovarian reserve, and unfortunately, increased risk of miscarriage. What you will see through this list of heavy metals is almost all of them have very similar effects in the body. So let's go to number 2. That's mercury. A study in the Journal of Toxicology found that mercury exposure is linked to menstrual disorders, subfertility, and pregnancy complications. Mercury is particularly concerning because it readily crosses the placenta and can accumulate in fetal tissue at higher concentrations than in the maternal blood. Cadmium. Research in reproductive toxicology demonstrated that cadmium mimics estrogen in the body, disrupting normal hormonal function. It's also been shown to damage the placenta and impair fetal growth. Arsenic has also been shown to reduce fertility, increase miscarriage rates, and cause potential developmental issues. Common sources of heavy metal exposure include contaminated water, particularly well water, which a lot of people consider is the best water. But unfortunately, you're going to need a filter no matter what kind of water you consume. Certain fish, especially large predatory fish like tuna and swordfish, are going to accumulate more toxins from the smaller fish that they consume. Old paint and pipes are going to maybe lead to lead exposure. Dental amalgams are certainly the biggest mercury exposures. Cigarette smoke has high amounts of cadmium, and rice and certain foods grown in contaminated soil can have a high amount of arsenic. I had a patient, Jackie, who experienced 3 miscarriages. When we tested her heavy metal levels, we found elevated mercury from her twice weekly tuna consumption. After 6 months of targeted mercury detoxification and changing her diet, she conceived and carried to term. Testing for heavy metals can be done in several ways. Blood tests are shown to be accurate for acute exposure in high quantities. However, blood tests are not super accurate for long-term or past exposure of toxins. Heavy metal analysis through hair mineral tissues has been shown to show exposure to heavy metals over the last 3 to 4 months. This is also not one of my favorite ways because a lot of things can be impacting the accumulation of heavy metals in your hair. The last is urine testing, and there's two ways to do urine testing. One is a challenge test where you take something that will cause the spillage of toxins from wherever they're stored so that they can be more accurately tested. And almost all of those tests are going to show positive because you just stimulated a bunch of toxins to be released into your bloodstream. Or an unchallenged test where you're going to get just like a baseline of what is happening in your urine or what's being tried to excrete through your urine. And if that comes up positive, then you usually want to do a challenge test as a secondary level of testing. So, for preconception detoxification of heavy metals, research supports chelation therapy under medical supervision for severe cases. Specific nutrients like alpha lipoic acid, glutathione, and modified citrus pectin can be extremely helpful to help excrete and get rid of the toxins that are being stimulated in the part of the chelation therapy or detoxification. Infrared sauna can help to promote elimination through sweat. This is really important therapy to incorporate while doing heavy metal detox. However, if obviously for the men in the room, you want to make sure that you are supporting or protecting the testes from high heat exposure. So in this case, we usually recommend an ice pack under the testicles to avoid the overheating of testicles while doing a sauna. But it's absolutely doable even for men. In addition to these, you want to make sure that there's adequate mineral intake because mineral deficiencies can increase heavy metal absorption. The presence of heavy metals will often kick off minerals. And if there are already mineral deficiencies, those heavy metals will kind of take over. And in order to help balance or tip the scale, there needs to be high amounts of minerals to help kick out some of the heavy metals off of these sites that are storing the heavy metals to begin with. It is crucial to note that heavy metal detoxification should be completed well before conception, ideally 3 to 6 months before conception even begins, because the excretion of these toxins or heavy metals is going to happen potentially for 3 to 6 months after you finish a detox phase. So you absolutely need to give adequate time in the process of detoxification. For those that are working in the agriculture industry, pesticides and herbicides exposure presents significant fertility challenges. A landmark study published in JAMA Internal Medicine found that women with high pesticide exposure had 26% lower probability of successful pregnancy compared with those with much lower exposure. For men, research suggests that occupational pesticide exposure was associated with reduced sperm quality and quantity. It's important to note here that if you live near an agricultural area, that is also enough to cause exposure, even if you are not out in the fields doing the farming and the applying of pesticides and herbicides. So it is extremely important to realize that for communities that are maybe having high exposure, like if you're in the wine country in Northern California or middle of Texas, those are all going to be high levels of exposure, and you want to be extremely careful to make sure that you're testing frequently to know whether you are getting high levels of exposure and finding ways to protect yourself against this exposure. Common agricultural toxins affecting fertility include organophosphates. These are pesticides that have been linked to reduced fertility and altered hormone levels. Research in environmental health perspectives found that men with higher organophosphate exposure had lower testosterone levels and poorer sperm quality. Atrazine, which is a common herbicide, has been shown to disrupt endocrine function. Studies in lab animals have found that even low levels of atrazine exposure can affect reproductive development and function. Atrazine has also been found in the water supply near these agricultural farms. So, if you are not filtering your water with a high quality water filter, the risk of exposure to these toxins is much, much higher. And I highly recommend getting a good quality water filter. If you're not sure what one you want to get, make sure to click below on our Divas Detox guide, which has a guidance on how to select a water filter that is going to be appropriate for you, along with links to water filters that I like that are approved for my clients specifically. Glyphosate exposure, also researched in environmental health, has raised concerns about the impact of glyphosate on reproductive health, including the potential effects on placental cells and embryonic development. If you work in agriculture, consider these protective measures. Using proper PPE, which is personal protective equipment, consistently. I will tell you that I had another patient who was actually doing the design and construction of gardens in Washington, D.C. And when I asked her about potential exposure to toxins, she denied it. She said, absolutely not. We do not have any exposure. It turns out that her levels of glyphosate were extremely high, and she was not using the protective equipment that could have protected her from that exposure. So, making sure that you are using the proper equipment is super important. Also, change your clothes and shower immediately after pesticide exposure. Consider organic farming methods whenever possible. Implement a targeted detox protocol during the off season well before conception. This has to be timed properly, so you do need to consult with a practitioner who's going to support you through this process, because this is not something that you do on your own. I've worked with a couple where the husband was a farmer with significant pesticide exposure. After implementing protective measures and a 4-month detox protocol focusing on supporting liver detoxification, his sperm parameters improved dramatically, and they conceived naturally after 2 years of trying unsuccessfully. Next, let's talk about some of the occupational exposures. The construction and industrial workers face unique toxin exposures that can significantly impact fertility. Key exposures in this area include solvents. Research published in Occupational and Environmental Medicine found that men exposed to solvents had approximately twice the risk of abnormal semen parameters. For women, solvent exposure had been linked to menstrual disorders and reduced fertility. Heavy metals, again, construction workers are often exposed to lead, cadmium, and other heavy metals through paint, dust, and building materials. A study in reproductive toxicology found that construction workers had higher levels of heavy metals and corresponding reductions in reproductive health markers. Welding fumes contain manganese and other metals that can impact reproductive health. Now, manganese is a mineral that we need in small amounts, but in high amounts can also be toxic. Research in International Journal of Andrology found that welders had poorer sperm quality compared to non-welders. Dust and particulate matters are not tiny, ignorable things. Silica, asbestos, and other particulates are often triggering inflammatory responses that indirectly affect reproductive function. A study in environmental health perspectives found association between particulate exposure and reduced fertility. Protective strategies in this arena include proper ventilation in work areas, consistent use of appropriate respirators and PPE, showering and changing clothes before returning home, regular HEPA air filtration in living spaces, and targeted detoxification support for specific exposures. Another patient whose husband worked in construction, his sperm analysis showed poor morphology and motility. After implementing workplace protections and a 3-month detox protocol focused on his specific exposures, his next semen analysis showed significant improvement, and they conceived 2 cycles later. But not least, we must address military exposures. So veterans face unique toxin burdens that can significantly impact fertility, yet these are rarely addressed in conventional fertility treatment. Key military exposures include burn pit exposures. The VA has recognized that burn pits, which were common in Iraq and Afghanistan, expose service members to numerous toxins. Research published in the Journal of Occupational and Environmental Medicine has found associations between burn pit exposure and reproductive health issues. Jet fuel and chemical exposures. These exposures can contain compounds that disrupt endocrine function. A study in reproductive toxicology found that jet fuel exposure was associated with hormonal imbalances and reduced fertility. Depleted uranium. Uses in certain ammunition and armor, depleted uranium has been linked to reproductive concerns. Research in environmental health perspectives has questions about its potential impact on reproductive health. PFAs from firefighting foam. I did not know this when I was early in my naturopathic medicine career, but one of my very early patients was a firefighter who had been that for close to 20 years. I knew that he had some exposure to toxins. We just could not find which one it was. And had I known to specifically test his PFAs, we may have found the answer. These forever chemicals are prevalent on military bases and have been linked to reproductive issues. And of course, firefighters are also exposed to the same. A study in environmental health found associations between PFAS exposure and reduced fertility. For veterans planning conception, consider requesting your exposure records from the military. Working with practitioners familiar with military exposure is really helpful because they will know what to test, when to test, and be able to support you in the detoxification process. Comprehensive testing for specific toxins based on your deployment history is necessary because testing every heavy metal and chemical exposure may be quite expensive. So having your records, knowing what we're testing for, and being able to target tests to what your exposures might have been is the smarter way to go. Targeted detoxification protocols based on your specific exposure profile is advisable. I've worked with several veteran patients who served in Iraq and were exposed to burn pits. After identifying elevated levels of specific toxins and implementing a 6-month detox protocol, we restored hormonal balance, and one of the women was able to conceive even after 3 years of unexplained infertility. That's just one example. We have lots of cases where exposure in military service was having a significant effect on fertility outcomes. So the VA now recognizes certain reproductive issues as potentially service connected. So veterans should explore the benefits that they may get through the VA as well. When dealing with these specific toxic burdens, generic detox protocols are just not enough. It requires personalized testing and targeted approaches that are going to target the specific toxins that you have been exposed to. Recommended testing includes heavy metal testing, ideally through urine tests and potentially provoked urine testing to identify specific metal burdens, organic compound testing, such as pesticide solvents and other organic materials, are available through urine and blood, and genetic testing, where we're testing genetic variants that affect detoxification capacity, such as genes like MTHFR, GSTM1, and SOD, which will help to personalize your therapeutic approach to detoxification and restoration so that you can move towards conception sooner rather than later. Besides standard liver panels, functional testing can also assess phase 1 and phase 2 detoxification capacities. So based on testing results, personalized protocols might include specific binders like modified citrus pectin for heavy metals or activated charcoal for organic compounds, targeted nutrients based on genetic variants, infrared sauna therapy, IV therapies under medical supervision for very severe cases. Remember, timing is crucial. These more intensive protocols should be completed at least 3 to 6 months before any attempt at conception, with a focus on gentle, supportive approaches as you move closer to conception. I always emphasize working with practitioners trained in environmental medicine and reproductive health when dealing with these specific toxin burdens. Whether you're a veteran, work in agriculture or construction, or have other unique exposures, addressing these hidden toxin burdens can be transformative for your fertility journey. Remember, the goal isn't to create fear, but to empower you with information and solutions. By identifying and addressing your specific toxin burdens well before conception, you're creating the optimal environment for a healthy pregnancy. In the next video, we'll cover specific supplement protocols for detoxification before conception. If you found this video useful, please hit the like, subscribe, thumbs up, all the things. Make sure to drop a comment with questions or ahas that you had during this video. And until next time, I'm Dr. Aumatma, and here's to your fertile future. Peace.